I go to toilet like 2 to 3 times a day and everyone is like, why do you poop so much? Why are you constipated?
Children are
Why
constipated
are you
all the
constipated?
time.
It's normal to poop every
You
day.
should be pooping every
and
day.
I'm happy that I have good bowel movement. Why are you constipated?
Peds Patrol here, and let's talk about pediatric constipation because it is something very, very common, and in fact, all children really have it and go through it. So you can imagine when you're a neonate, when you're an infant, when you're a toddler, when you're a child, and then you're a teenager, your diet is so variable. And this can cause a lot of frustrations among parents and caregivers because you think you have constipation under control and then suddenly they become picky eaters or they have sensory changes or you go on vacation or they find something that they really, really like that's not healthy and it can lead to constipation and bouts of constipation. And then what makes it worse is when you go to school, you have holding pattern behaviors, you get bullied, you get soiling, and so it can be quite a bit of a challenge, especially in children. So to put it quite plainly and simply, every child should have one poop a day, otherwise known as an easy poop. So E stands for every single day and once a day. You should feel all empty. So that means that when you go to the bathroom and have a bowel movement, you shouldn't feel like you need to go again. It should be soft. So what that means that it kind of looks like a brown log or like the poop emoji. And lastly, the child should feel comfortable, or you should feel comfortable, which means that before, during, and after, it shouldn't cause any pain, strain, or discomfort. If your child doesn't have an easy poop, there could be many, many reasons, but most children have what's called functional constipation. This is usually not due to any type of pathological problem like a genetic disease or something happening with their bowels like malabsorption or any anatomical issues. Simply, it can just be due to like the issues that I mentioned above, which is social issues, food issues, and holding behaviors. So your child may need to drink more water or increase fiber in their diet. So here, for example, is a graph on how much fiber every child should be getting based on their age. So you can think about like whole grains or cereals or other products that can increase water in your bowels, and it makes the poop softer and it comes out much, much easier. Thinking about eating more vegetables, eating more complex fruits, and avoiding sugary products like sodas and juices. Thinking about prune juice or pear juice, all of those things can really help bulk the stool and make the child get an easy poop. Now, if this doesn't work and you do actually need treatment for your child, there's many medical and non-medical management options. Talk to your family doctor, talk to your pediatrician to figure out whether or not you may need a laxative or a stool softener. And most importantly is that if your child is constipated and things are not getting any better, whether that's through food, diet, exercise, or even some basic medication, you may need to be investigated for any other pathological problem. So constipation could be a sign of celiac disease or inflammatory bowel disease or low thyroid. Sometimes it could be social situations like your child is more anxious. Constipation could be a symptom of neurodevelopmental issues like ADHD and autism. So remember, constipation shouldn't be hard, it should be easy.